So you have in front of you, the first page are your learning objectives for today, which consist of understanding the pathophysiology of rheumatoid arthritis, osteoarthritis, and septic arthritis, to understand what helps with the pain of arthritis, and then how septic arthritis is diagnosed and treated. So there are multiple different kinds of arthritis, over 100 different kinds. We're going to talk about just these three. Osteoarthritis is extremely common, rheumatoid arthritis is extremely common, and septic arthritis is not so common, but because I'm an emergency doctor, and this is an emergency, it's an orthopedic emergency, I like talking about it. So, and arthritis is Greek, it means inflamed joint. Arthro means joint, itis means inflamed. Now this is an x-ray of a normal hand. And we're going to come back to this x-ray multiple times, but this illustrates some things. So the white stuff is bones, the stuff that's dark between the bones is the joint. And one of the things I want you to notice is how nice and smooth this normal joint is. That is a normal joint. And this is a cartoon illustrating kind of the insides of a normal joint. So this is a knee in cross section. It's a femur, tibia, kneecap, or patella. You've all probably eaten chicken and broken open the chicken joint, and you've seen the white stuff inside. That's cartilage. Looks just like that in our bones. And that's what this is, cartilage, nice and smooth. So it's slippery. Inside these joints is joint oil called synovial fluid. So it's surrounded by synovial membrane. The joint's surrounded by synovial membrane, which creates synovial fluid. It's just slippery fluid. It's just like oil in a car. And so that's what a normal joint looks like. In arthritis, those systems fail. We're going to look at this illustration a couple of times because there's a cartoon here that illustrates osteoarthritis and a cartoon that illustrates rheumatoid arthritis. And osteoarthritis really is just worn out joint. Human body wasn't designed to live to 85 years old. You know, for the vast majority of our time on this planet, life expectancy has been about 25 years. And then people would die. They'd get eaten by a saber-toothed tiger or something like that. But we're living a lot longer now, and our joints have a chance to wear out. There's a genetic component to this as well, but really it's wear and tear on the joint. And what happens over time is that the cartilage gets degraded. I have multiple cartoons I'm going to show you about this. But the cartilage gets degraded, and it's just bone rubbing on bone. That slippery, nice cartilage is gone. That synovial fluid that makes it all lubricated is still there, but it can't lubricate the bone as well. This is a cartoon of a hand showing somebody with osteoarthritis. This is called fusiform joints, so the joints are swollen, they're painful. You see that, Linda? Mm-hmm. And this is an x-ray of somebody's hand that has osteoarthritis. Once again, normal x-ray, right here. Nice, clean, smooth joints. And with osteoarthritis, this is a good x-ray because it shows you this joint is perfect. This joint is degraded. It's bone on bone. And that's one of the characteristics of osteoarthritis is that it won't necessarily affect all the joints. It might just affect your knee, or your hip, or your hand, or your wrist.
This one.
And it doesn't necessarily, or your finger.
Sticking out.
Exactly. And it doesn't necessarily affect both sides of the body equally. If one joint, if you have kind of a funny gait because you have a bad back, and maybe you stress one hip more than another, that's the one that may get arthritis. But nice, smooth, clean joint. And this is a joint that's being eaten away by arthritis, bone on bone. And you can see how white this bone is. That's called sclerosis. That's scarring of the bone taking impacts that it's not supposed to take. And so just imagine how painful this is. And one of the points I want to make sure I make in these presentations is that a lot of our clients have dementia. And as dementia progresses, people become less and less able to express themselves. That's called aphasia. And when you have one of our clients that has dementia or aphasia and they have behavior problems or acting out problems, think pain. Because they've had arthritis for the last 40 years, and now they've had dementia for 10 years, and they can't ask for Tylenol anymore because they can't speak. Think pain. So you can help alleviate their suffering. Here's another cartoon, healthy knee joint, nice smooth cartilage, synovial fluid bathing that. This cartilage is gone, bone on bone, there's bony spurs there. The joint space is gone as well. Here's an illustration of a hip, nice smooth cartilage in this hip, this perfect hip. This is bone on bone, grinding bone on bone. Just, it's wear and tear. It's wear and tear. Osteoarthritis, because it's kind of wear and tear, tends to be better in the morning and worse at night. One of the things you want to do with your clients that have arthritis, have painful joints, is preserve their ability to be physically active. You know, if someone is in pain and they don't exercise their joints or muscles, those muscles atrophy, and balance is a matter of practice. You have to get up and walk once in a while to be able to have good balance. And if you don't, then you're at higher risk for falling. One of the things we do when we go into our client's home is look for any trip hazards or fall hazards. And one big fall risk is somebody not getting up and using their muscles once in a while. So we want to encourage our clients to use their muscles, to stay active to the point that they can. So one of the things you think about, someone with osteoarthritis, okay, I know that in the morning it's going to be a little bit better at night because they've been on their joints all day and now they're really sore at night. So we're going to go for that walk around the block in the morning as soon as they get up. Okay? Okay. Treatment for osteoarthritis consists simply initially of just some pain control. You can apply heat to the joint, that will help. So you can put a hot pack on the person's knee if their knee is hurting them. If they have multiple joints that are affected, have them take a hot bath, that'll help relieve the heat, the pain. Tylenol is useful. Tylenol in excess can cause liver damage though. Non-steroidal anti-inflammatories are very useful because those are medicines like naproxen and Motrin and ibuprofen and aspirin, and those are great because they both are anti-inflammatory, so they work at the site of the inflammation as well as in the brain to decrease your sensation of pain. So they work in two ways, but they can cause ulcers in the stomach, erosion of the stomach, gastritis, esophagitis, gastrointestinal hemorrhage, the actual bleeding. And in excess can cause kidney damage. So Tylenol can cause liver damage. NSAIDs, non-steroidal anti-inflammatories, can cause kidney damage. Okay. All right. Rheumatoid arthritis, once again, is arthritis. It's inflammation of the joint. Totally different mechanism than osteoarthritis. This is an autoimmune disorder. Your body is making antibodies against the joints, and it doesn't just affect the joints. Multiple organ systems are affected as well. In this disease, there's actual destruction of the bone as well. You'll see an x-ray that illustrates that really well. This is often worse in the morning. So these folks, you may do their walk around the block toward the evening when the pain isn't quite as bad. So this is the same cartoon you saw before, normal joint, and you have this in your slide set. Osteoarthritis, rheumatoid arthritis at the far right over there. And so in this case, there's antibodies being made against the joint itself. The synovial fluid is inflamed, and the synovial, the joint space is swollen. You can see that there's actually bone being eroded by these antibodies attacking the joint. And this is an example of a picture of somebody's hand that has rheumatoid arthritis. It's a very characteristic appearance. And you will take a look when you go out into the community, you go to restaurants, you take a look at in the checkout line at the grocery store, you'll see people with hands like this and you'll know they maybe have rheumatoid arthritis. This is called ulnar deviation. So that bone in the forearm is called the ulnar bone. That other bone is called the radius, and these fingers are deviating toward the ulna, so it's called ulnar deviation. And these joints here, these metacarpal joints, are destroyed. Take a look at this x-ray. This is somebody with rheumatoid arthritis. You can see there's no joint tissue. There's no joint at all. I mean, the joint and the bone is being eaten away. And so I can only imagine the pain these people are going through with this just chunks of bone ripping on one another. This person's metacarpal is almost completely dislocated. It's so far deviated. And you can once again see the ulnar deviation of both of these hands, both of these sets of fingers. It's a normal one to compare with. Because this is a systemic disease, it affects multiple organ systems, it affects the joints symmetrically. So maybe both shoulders, both knees, both hips, both wrists, whatever. Remember, osteoarthritis is not like that. In osteoarthritis, which is wear and tear, you might have just one wrist affected or one hip affected. In these guys, it's usually both. And as I said before, because it's a systemic disease process, it affects multiple organ systems. Now, pain control in these guys is consists of a different kind of arsenal of drugs than in osteoarthritis. Certainly Tylenol and ibuprofen, those things work as well. Maybe narcotics. And people with osteoarthritis can use narcotics as well. Some of the narcotic preparations are combination medications like hydrocodone plus acetaminophen. So that's Vicodin or Toradol or Vicodin or Lortab, or Percocet, which is oxycodone plus acetaminophen, which is Tylenol. These guys can also be treated with anti-metabolic drugs like methotrexate, things that are used for very serious disease processes, can be used to kind of shut down the immune system. And then finally, surgery. Osteoarthritis is treated with surgery as well. Your parents had meniscus surgery just now, but they could have a total knee replacement for their arthritis, or a total hip replacement, or a total shoulder replacement.
Why would you want to suppress the immune system?
Because it's the immune system that is attacking your body.
Oh, I see.
So your immune system is called autoimmune disorder, and so your body's attacking itself with antibodies.
So it's similar to cancer in that respect?
No, it's different than cancer.
Oh.
There's sometimes an immune response to cancer as well, but it's like like multiple sclerosis is an autoimmune disorder. There are a variety of autoimmune disorders out there, but this one affects the joints. Okay, so we talked about osteoarthritis, we talked about rheumatoid arthritis, and now septic arthritis. It's an infection of the joint. It's an orthopedic emergency. This is a photograph of somebody with septic arthritis. Now, sometimes it's difficult to tell in the ER when you look at a joint that's inflamed if it's septic arthritis or another type of arthritis like gout or something like that, or pseudo-gout. Because gout will have a hot red joint as well. But this one's pretty obvious. You can see the normal leg on this side, the septic leg on this side, and you can kind of get a sense here of the pressure inside that joint. It's just bulging right there. So what happened with this guy is that he tripped, barked his shin, which disrupted the skin. That allows a portal of entry for bacteria into the skin, which resulted in a cellulitis, which is a skin infection. As that cellulitis progressed, it filtered into the joint itself. Now you have bacteria in the joint, and you have white blood cells in the joint. You have antibodies in the joint. There's a fight going on in the joint. Septic arthritis. That is an orthopedic emergency. And the way it's diagnosed is I have to stick a needle in the joint and pull out some fluid, which I do on a routine basis in the ER. And we examine the fluid for bacteria or for excessive amount of white blood cells. And we look at other things like glucose and protein content as well that will give us a profile that looks like infection. Now, I have somebody in the ER with septic arthritis. They have to go to the operating room, have an orthopedic surgeon open it up and wash it out and clean it up. And this is why I'm hanging IV antibiotics as well. So if at 3 o'clock in the morning I see this, the orthopod better be in the OR at 4 o'clock in the morning washing it out. So if I'm calling the orthopod and they're giving me blowback about this, my response is get in here and look at this yourself. And every time I've done it, they're in the OR a half hour later getting washed out. If I don't do that, then this person's going to have that knee you saw, they're going to have a peg leg because the joint's going to be destroyed. It's going to be gone. So it's diagnosed by aspirating the joint, sticking a needle in it. There's some blood tests I get that might help me as well.
Will that develop really quickly?
Oh yeah.
In a matter of hours?
They can.
Wow.
They can, for sure. So I diagnose this, I'm suspicious, I hang IV antibiotics, I call the orthopod, we fire up the OR, we go in. All right, so I think that's it. So we talked about that there's more than 100 different kinds of arthritis. We talked today only about osteoarthritis, rheumatoid arthritis, and septic arthritis. We talked about treatment for each of those. Osteoarthritis is often better in the morning, worse at night, opposite for rheumatoid arthritis. We want our clients to stay active that have arthritis. We talked about pain. Some of these people with these diseases maybe have dementia now and they can't express that they have pain. So think pain and give them a Tylenol. Give them their Lortab if they're having behavior problems. Perhaps that's going to help them with their pain. Finally, we talked about septic arthritis. Any questions about that before we go on to the test? No? Okay. Remember, the goal is to keep our clients active and help them control their pain. Oh, the last thing I want to say about pain is that it's better to treat pain before you're experiencing it. If you have a chronic disease process, so if your Lortab is every 4 hours, don't wait till 5 hours when the pain is present, because getting on top of it and pulling it back is way harder than treating it before it occurs, so that you don't ever experience that pain in the first place. So pain control is very important. No questions? All right.